Go ahead and ask that question again.
Why do glasses make me feel better?
Well, since you ask, there are some interesting things that are happening to your whole organization, your physiology. So you talked to me about working with a provider who started with a foundation and treating at the ankles and then your right knee and then treating your shoulders before getting to your neck.
Yeah.
And that this release is this whole body trying to address scoliosis. And so the body as a whole is getting command central from the brain and organized around this central column called the spinal column, and that is a central nervous system within an encasing, which is the vertebra. And so if you take a garden hose and you start to deviate the path, it's going to be less efficient, and maybe the water that's coming through the path is not all of the water in the order that it was entering the hose, right?
Fair.
So if you think about sort of fluid dynamics and what happens to rivers and so forth, you're going to find areas within a river that water moves faster or water moves slower because the bends in the river are changing the fluid dynamics. So you've got also circuitry dynamics that are happening. And if you're putting your circuits, which are your neurons, under stress by having these different torques and so forth, you're creating asymmetries in the signal. Ultimately, you're human in a human environment. So we walk on our two legs generally, and we are oriented to the 3 dimensions of our space, and we plan our movements and when we're going to be there. So we're dealing with the 4th dimension of time. And that helps us with accounting for planning and interaction and becoming more accurate at how we aim our eyes for things. And we are designed to most successfully coordinate the eyes for looking far and close when our eyes are on a parallel to the horizon. So there is a requirement that your body would like to serve that your eyes are parallel to the plane of the earth. But your garden hose has been tipping in different directions. So in order to meet that requirement of eyes parallel to the earth, you're then creating, right now, your neck emerges from, let's say, center of body and then displaces slightly, much less than used to your right. And then you are counterbalancing with a little bit of a tilt of your head to the left. And so what I did, trying to enable your visual system to feel oriented in space and release at that occipital joint and carry down the whole column, was that I took your sense of the planes of the earth and I twisted them. So that you would be encouraged to untilt your head to the left by righting your head a bit more. And right away I sense that with this peculiar skill set that I've developed, the release happening at your occiput, and I could feel your left ear clearing, and like that it's carrying through this 3D puzzle that is your cranium, which is wild and wonderful.
Very cool.
But and then it doesn't just end there, because these parts are all connected. So even though you're seated, you started to release tension in your throat because you have less value of putting tension on your neck to get your head in position, to put your eyes in position to take in your environment. And so all of those things that are guiding you towards alignment are being served by an adjustment in the lens.
Very cool.
Really awesome.